Good afternoon, Professor, Doctor, and colleagues. I'm Dr. Tai. Today, I present the outcome of human umbilical cord derived mesenchymal stem cell transplantation in treatment patients with bronchopulmonary displasia. The study was done by Neonatology Department of Vinmec and Vinmec Research Institute. In my topic, I have as a background, methods, outcome, and conclusion. The first about the background, the BPD was defined by require oxygen mechanical ventilation at 28 days. Both natural eyes are 36 weeks of post natural eyes patient return. In 2016, the NICHG conference defined three grades, mild, moderate, and severe, depending on the kind of support for patient respiratory distress syndrome with BPD and concentration of oxygen. The prolonged outcome of BPD patient is a big problem. In the moderate BPD group, the ratio recurrent hospital admission in year 1 is 4.3 times, in year 2 is 2.6 times, and in severe BPD group increase so much 7.7 at year 1 and 3.6 at year 2. The mortality of BPD about 23% in moderate and severe group was 55%. About 25 to 37 of baby with BPD develop associated with pulmonary artery hypertension, and survival rate of PH BPD group at 6 months is 64%, and at year 2 degree 53%. Developmental impairment is a problem and different increase with the rest severe BPD. A severe group, it increased 61.9%. The treatment BPD includes mechanical ventilation, survival therapy, oxygen, and some drug, for example, corticoid, bronchodilator, diuretic, but many side effects. For example, develop mental delay, increase heart rate, affects develop psychology. So stem cell transplantation is a new way for treatment, and now perform study in many countries on preclinical for BPD with transplantation was successfully, and they see that the stem cell can reduce inflammation, increase overall, and decrease pulmonary inflammation, response, vascular injury, fibrosis, prevention pulmonary hypertension. On clinical trial, the first clinical trial to prevent BPD in preterm infant was performed at 2014 in Korea and have successfully. In Vietnam, we have first grade in 2016. We performed treatment for BPD with mono stem cell from the bone marrow, and we have successfully. From 2018 to 2019, we have a 4K BPD patient, severe BPD patient, was treated with autonomous human umbilical MSC to the IV, and we have successfully until now for patient survival. As a method, in my study, we have two objects. The first evaluate efficiency of the stem cell transplantation, and the second evaluated the safety of the methods. The study design is an open label uncontrolled clinical trial at phase 1. and the sample size is 18 patients. We users analyze it with API 20 version, and we save the data at the record in match.com. Duration time for this for research from August 2018 to October 2021. We include some criteria for choose patient. All patients diagnosed with BPD according to the NIC HD guideline 2016 without improvement with treatment with dexamethasone, diuretic, inhaler, that bronchodilator, and correct ICE under 6 months. We exclude the patient with complication malformation, for example, complicated congenital heart disease, diaphragm hernia, and patient with acute severe condition, for example, active infection, lung bleeding, IVS after surgery. The patient was intervened with MSC infusion by IV for 60 minutes in 2 times. The first time in after 7 days with dose 1 million cells per kilogram. We use a metal prednisolone infusion for transplantation 30 minutes to prevent an anaphylactic shock. We follow up the vital sign and some test to determine the other event for patient. In patient was a follow-up inhibitor within 3 days after transplantation. And after that, patient were rechecked at 1, 3, 6, and 9 months after discharge. We check clinical assessment, APO2, we check some tests, for example, IBC, total blood cell count, or BNP, kidney liver function, and the check X-ray at 1, 3, 9 months, and CT at 6 months. And after that, we interview mother or father, or recheck for patient after 3 or 6 months. About the outcome, the characteristic of patient before transplantation. We have one patient at grade 1 and 2 patients at grade severe, and 15 patients at moderate grade. We have a 94.4 patient with PH condition. On echocardiogram, we check the pressure gradient mark through the tricuspid radial mutation. And we have 5 patients with PC mark above 40 mm per cube, and 4 patients from 30 to 40 mm per cube. Pro-BNP marker were checked before transplantation, and the average is 2,619 nanogram per milliliter, and we only one patient no sign of BPD on clinical and on echo and marker pro-BNP. We have the average gestation at birth mean is 1,012 gram, and gestation mean 27 weeks of gestation. 55.5% have a hypercapnia condition, and APO to lower 80% in 55.5%. Duration on mechanical ventilation above 2 months is 61.1%, and 100% patient have the use dexamethasone cause the treatment, but improved. We have a 61.1% patient is a male, and 61.1% was a transplantation after 44 weeks of gestation. Duration depending on resident for transplantation. almost patient depending on those season from 91 days to 180 days. And one patient depending on the oxygen upper 180 days. About the outcome, we have the 14 event within first week after transplantation, includes hypoxia, hyponatremia, less sleep, tacroting, hypercapnia, increased OBNP, anemia, conjunctivitis. And total our event we have is a 18 sick event, and almost event is a common disease in children in first 3 years. About 53.5% patient have a respiratory problem. CE problem is 14% in fever and nutrition and other. So relative to study agent with adverse event, we have in the first week, 14.3% patient may be positive relative, and 4.6% in total adverse event possibly relative. No event for properly related and defined natally related. The severity of the event in the first week, we have the 14.2 2% have a severe event, baby needs follow-up in hospital. That's baby has anemia, we need a transfusion, and baby has a nosocomial, baby need a treatment with antibiotic. And 38.4% patient have a severe severity a total. That's almost patient have a respiratory tract infection, and baby needs follow-up and treatment in hospital. And 4K deaths caused by the reason I said about that. The mortality in our group is 27.8%, and okay survivor baby can win from oxygen. So mortality in PH group at 2 years is 15.4%, and lower other study with 47% at year 2 was performed by Ken Mania. In for that case, we have 2 case. We have caused by respiratory syncytial virus, pneumonia, and when the baby discharged, baby case, and then baby have a respiratory failure and needs intubation. 1 case baby caused by Streptococcus aureus pneumonia. This baby, the patient baby severe condition, patient on invasive mechanical ventilation on transplantation with hypercapnia in PS. And the last case, the patient has pneumonia caused by the rhinovirus, and baby readmitted hospital, and then baby died. In a survivor group, we have an unclinical trajectory after transplantation at the moment. 84.6% patient upper 2 years, and 64% with normal weight. And in this group, we have the 4 patients with weight percentile upper 30 percentile. 35.7 patient we check and with normal check for normal formation, and 78.5 patient with developmental normal. Then we check of some patient in our group. The 2 patient actually premature with a gestation at birth lower 26 week of gestation in patient was transplantation early before 44 weeks of gestation, and nowadays baby with normal weight and normal chest. And the third picture is a patient was birth at 29 weeks of gestation, and patient was a transplantation at 5 months after birth. Patient with normal weight, the chest are abnormal. Duration time depending on oxygen after transplantation, almost carry baby can bring from oxygen from 1 to 3 months with 64.3%. The average time to bring from oxygen 2.4 months, and only one carry baby can bring from oxygen at 10 months. 53.8% patient can stop using the PH drug before 12 months after transplantation, and 92.3% patient can read from oxygen before 6 months. This is a chart. I want to present FPO2 before and after transplantation. Different before and after with significant with P 0.000. And no person have a hypercapnia condition after transplantation at 9 to 12 months with significant and chronic hypercapnia. No person have after transplantation. Different before and after, we have a significant with P 0.008. In pro-BNP before and after transplantation, different have a significant with P lower 0.02 in a group have a problem. And recurrent respiratory infection in two first year, we have the patient in J1 readmitted hospital with respiratory infection is 1.36 times, in J2 is 1.8 times. And this is some picture from patient in our group. This is checked by this is before. Yeah, you can see the metastasis, fibrosis, and opacity, and after that it getting better. And this in the CT scanner. A conclusion in our group, 18 patients with PPD, with 94.4 patients with PH, 63.6 patients with hypercapnia, and prolonged hypercapnia or chronic hypercapnia. Stem cell transplantation with donor MSC with 1 million per kilogram, 2 times interval 7 days by weigh-in in 60 minutes, no severe event related. In PH group, the mortality is 15.4%. The two, and patient can win from oxygen with average 2.4 months after transplantation. 53.8% can stop users PH drug before 12 months after transplantation, and no case has hypercapnia after transplantation at 9 to 12 months. Recurrent admitted hospital caused by the infection problem. As your one is 1.3 times, and the two is 1.8 times. And in our group, our survivor group, 64% patient with normal weight, and 78.5% patient with normal developmental. That's all. This is the outcome of my study. Thank you for your attention. Thank you so much.